Okay, you're seeing the document, right?
Yes.
So, Cali Group, these are the medicines that are in your list for you to study. Calicarb, Calibi, Calibrom, Calinitricum, and Califos.
Okay.
I mean, for the comparison, but Cali Group is comparatively very big. You can see in total
Yeah.
25 remedies are there. But out of this, even if you ask me for a prescription basis, uh, this one is also important. I have seen only this much medicines being prescribed, which is this green
Mm.
color. One is Calios, then Cali hydroiodicum, but we usually say as Cali iodide or Cali iodatum. This hydro is often left from that
Mhm.
name. Then Calimuraticum and Calisulfuricum. And Calimuraticum and Calisulfuricum we usually use as a biochem. It's one of the biochems that we use. And Caliarsenicum, I mean, it is clinically important. That's why I'm just saying these things. Caliarsenicum, it
Mhm.
is more having features of arsenic group. So, arsenic, they have action on mind, respiratory, and skin. But when it becomes Caliarsenicum, the features that is coming out is actually of skin. So this is a very good remedy to give in case of psoriasis. Any
Oh.
itchy, flaky diseases, Calios is a very good remedy. So actually, I have seen my one of my professor prescribing this for a psoriasis patient, Caliarsenic,
Mhm.
and also this is a medicine because arsenic, uh, as such, arsenic group is actually destruction. It can cause the destruction of the organs and all. So the patient will be always in a terminal stage like cholera. So arsenic can cause destruction. So it has got a tendency to produce cancer. Oh, it can be given
Mhm.
in cancerous patient. And similar is Cali group. Cali group is also actually very deep acting remedies. It is very less prescribed for acute conditions. Cali group is not generally prescribed for acute conditions. Cali carb, asthma is very nice. I mean, its action in asthma is very good. So maybe in acute exacerbation, we can think about Cali carb 30, but
Mhm.
mostly and also Calibi for respiratory, but mostly they we take it or prescribe this Cali group as a constitutional remedy because these are more deep acting
Okay.
remedies. So Cali is also having a cancerous tendency, and hence Cali as when it comes together, this is a medicine more indicated for psoriasis. And psoriasis also, even though it is not becoming a cancer condition, there is destruction that of the
Yeah.
superficial epidermal layers. There is increased turnover. So that is why it is coming for psoriasis and also a good remedy for skin cancers. That is the importance of Callias and Cali idatum. This is a very good remedy in case of acute inflammatory joint conditions. So if there is a joints where there is extreme reddishness, the
Mhm.
acute inflammatory condition, extreme reddishness and swelling, the pain, especially of the knee joint, caliidatum is a very good remedy. And one of the feature of Cali group is actually that will come in the general features, but I'm just saying now because I have to mention about idatum. Idatum is actually iodine. If you remember, it is actually a very hot patient. It is indicated
Yeah.
for hypothyroidism, so it's a hot patient. And Cali is generally chilly patients. There are exceptions, but it is generally chilly
Mhm.
patients. So caliidatum actually it shows the iodide feature more. So it will be a hot patient generally. But one of the feature of Cali group is a dynamia. We'll be coming through that word. A dynamia means these are so weak constitutions that their body can't even respond properly. So that uh, they will be having always a hypothermia. There is no increased
Mhm.
temperature. So even when in case of caliidatum, even when there is the reddishness or acute inflamed condition, we feel that it is extremely red and inflamed also, swollen also. And one of the common feature of inflammation, not common feature, the five signs of inflammation is actually heat. But when we give caliidatum, uh,
Mhm.
these patients will be having some reddishness, may not be as reddish like the belladonna stage and all, but there may be some reddishness. The swelling may be the swelling, not maybe, swelling will be the, it will be highly swollen, and what is that? The pain will be the, but the temperature, as we expect, will not be there. It will be cold to touch. So it won't be in an acute inflammatory condition per se, because the temperature won't be a characteristic, but swelling of the knee joints especially, and also pain.
Mhm.
Caliidatum is a very good remedy to reduce that swelling and pain, because Cali group, they have a great action in edema. So these are the things, I mean, because these drugs won't be coming in the later. That's why I just mentioned the clinical features. And Calimureticum calisulf is usually used as a biochem. Calimureticum similar, like if a person is coming for cold conditions, and there is some pulsatilla like discharges, the thick blunt or thick yellow discharges, then as a biochem, when we give pulsatilla to the patient, either we can give for placebo or just give calimureticum. And calisulf usually given for skin conditions. I mean, when we are giving some constitutional remedy for skin,
Mhm.
either we can go for a calisulf prescription for a plus, I mean, the tablet, because our main medicine will be only one powder. So the patient will be like, is this one powder enough? Generally, because they are accustomed of eating the three or four, five medicines twice a day, and then we give one powder. They will be very skeptical. So we give the placebo. So either you
Mhm.
can give for the placebo, or we can give the biochem. There are doctors. I mean, I was taught to give biochem in my colleges, because they used to say it is more or less like tissue salts, or the deficiency being covered. So at least let the tissues, I mean, this element, not elements, this compounds, let it go as a nutritional basis or nutritional supplement. That is what it was taught in my school, my college. But there are teachers or my seniors who don't prescribe even uh, this biochems along with constitutional remedy. They prescribe only placebo, the BT, the blank tablets, because they believe that even if it is 6x, there is some medicinal content. But
Mhm.
other teachers, they have the concept that even though it is 6x, the 6x, according to what we study and biochem, it is not having a dynamic action. It is acting on our cells and tissues directly. It is not coming into the vital force or anything, just nutritional supplement. So when we are giving constitutional remedy, we are actually giving the medicine in centesimal potency, 30 or 200. And 6x is always decimal potency. So this is acting on two different level. That is some teachers or some people or homeopaths explanation. Like the medicine, the constitutional remedy, we are giving 30 or 200 or one number, whatever. That is actually having a dynamic action on the vital force. But this one is
Mhm.
having a nutritional action on the cells and tissues. So when the action also is different, how it matters. So it is up to you, whatever you wish to practice. Both are working. You just have to find out your own working way. So this is where the other remedies usually prescribed, and all the other medicines. I don't know any doctor uses it or not.
Okay.
These medicines are there this much. So going towards the characteristics of potassium as a metal, it does not occur in nature in free state. So it's always seen in combined. And then this we can see in the analogy also. They don't like to sit alone. They always want to be in company. So it is a soft silvery white metal and member of the alkali group. Sodium, potassium, everything comes in the same one. Potassium is silvery when first cut, but it oxidizes rapidly in air and tarnish within minutes. Hence, it is
Mhm.
stored under oil or grease. But it is not stored in water, because when it is kept with water, it is so having affinity to hydrogen, or with the water, and it instantly reacts with it, producing a lilac color. So it is not stored under water, but always kept in grease or in oil. Then it is slightly radioactive and emit beta rays. And potassium, it is present in our body, K positive. It is an important intracellular cation inside the cell. And sodium is actually outside, the extracellular. So almost 98% of potassium in the body is found within the cells. And excess of potassium, we call it as hyperkalemia, and deficiency, which will be hypokalemia. And we do have so many clinical features in hyper and hypokalemia. But whatever it is, whether hyper or hypo, there will be some cardiac arrhythmia. Potassium is very important for the rhythmicity of the this one. What is that? Heart. So if there is increase or decrease, some arrhythmia is going to happen, and we can understand it by ECG also. Then these are the
Okay.
normal values of human body, potassium in human body. So now we apply the analogy. So potassium is an alkaline substance and it has got great affinity for water. We saw how it very um, explosively, or not explosively, it very widely reacts with water. So when this acts on skin, Kali group can produce very deep excoriating effects, like deep, dry excoriating effects, which means Kali group can be given, or Kali medicines can be given for people who are having dry excoriated skin, because they have the tendency. The When I was just going through, I had almost forgotten my chemistry, but still when I was going through, the potassium is actually having one atom in the outer layer, the orbit. I forgot its chemical term and all. So they will have a tendency to leave this electron and then to come into a stable position. So for that, they want to combine with the hydrogen ion. So that is why they attract this hydrogen cation. Cation means it should be leaving or
Positive.
anion. Huh?
Iron is positive, right? Yeah.
Yeah, cation is positive. Uh, so is it leaving the ion or it is adding the ion? Oh my God, I forgot. Okay, leave. I'm not getting making you confused. So anyway, it has got a great affinity for water, and because of that, it will be attracting water with it. So most indicatingly, it is very good for. We apply it to the other way around. For dry excoriated skin, Kali group can be given, and that's the feature we see in why the Calisulf is given for the psoriatic conditions, and also the other remedy, Cali arsenicum. Cali arsenicum we give in potency, the centesimal, and Calisulf we give in psoriatic conditions, but as a biochem usually. So they have this producing the skin will become dry if we are giving Cali group. So better indicated in people with dry skin, dry excoriated skin. Then potash, which is actually a compound of potassium, poisonous in nature. So when that is taken, one of the poisonous effect will be paralyzing the muscles by potash. So we can see in potassium or the Kali group, the persons will be having a general weakness,
Hmm.
muscular weakness, exhaustion, and also convalescence from protracted diseases such as typhoid fever. So people who are very tired, debilitated, weak, and even sometimes to the level of paralysis. So these symptoms are very much covered by Kali group. Then organic potassium is a powerful neutralizer and flushing agent. So when in Materia medica, the analogy can be this is a good remedy for constipation and also as a circulation improver.
Okay.
So like our, what is that, calcarea carb. This is also good for constipation, and some similarities though with calicarb and also calcarea. Calcarea is also very fat constitution. Calicarb is
Hmm.
also a fatty constitution, Then both calcarea carb and cali carb are actually chili patients. Then both are having GIT actions. This one, cali carb and calcarea, they have constipation, and they also have uh, gas trouble. That the food will be converted into gas, so much gas. So both are very much similar in case cali carb and calcarea carb. When there is imbalance in the level of potassium, the cardiac arrhythmias are common. So Kali group also have action on heart. Potassium comes in the same group as sodium. So
Mhm.
sodium in mental level, they have a feature. Sodium in the mental level means in homeopathically. They have that we'll see in the next class when we do the sodium group. So they have similar feelings like in case of sodium, they want to be always in a relationship. So because potassium also come in that same group, we can see that potassium also need to be in a relationship. So I think the cation should be adding someone. There is one electron and they want to become two and then become the complete the valency. It should be like that, accepting, not leaving. Should be accepting. Uh, we just Google what is cation is doing.
Okay.
Don't accept so many people search it. Uh, Enter me. Usually metals lose their valence electrons to form cations, while non-metals accept electrons and form anions. In order to take the atom, positive charge must give away. I have to sit and read, I think. That much I have forgotten chemistry. Do you remember?
What? What? Cation
Whether it is,
does?
yeah, whether it is accepting or it is releasing. Negative might
I
imply
honestly
that
forgot.
cation.
That was like years ago.
For you, it is yes. Oh my God. A cation donate two electrons. Oh, they are donating. Then it can't be
Yeah.
that much of it, whatever. Anyway, so they anyway need a relationship like sodium and they're
Mhm.
dependent on relationship. So this is a statement I found so interesting. Sodium needs one person, like they need that relationship. We can connect it with matrimony. They have
Mhm.
the complaints from disappointed love. So they need that one-to-one relation. Magnesium needs one mother because mostly for nourishment. If you remember, have you studied any one of the magnesium medicine? McCarb or McMoore, not
No.
McForce.
Like,
Okay, so when you learn, you will understand MacHub and also MacMove.
mhm.
Mostly the complaints are GI2 related and nutrition or nourishment related because the magnesia, milk of magnesia that has been used in earlier times for all the GIT complaints. So magnesia was a medicine. Whenever constipation happened, people used to take this milk of magnesia. That's what
Mhm.
it's chemically called. So it has got a cathartic effect. Like constipation, it will be producing a cathartic effect, like diarrhea, or the constipation will be relieved. So people at that time, when these medicines were being proved in that 18th, 19th century, one of the treatment mode of that time was to give these cathartics whenever they are having constipation. And cathartics was mainly of either silicea or the silicon one, or it was based on magnesia. So that is why magnesia has got, when the proving was done, it has got a lot of action on GIT complaints. So magnesium, they say that they need one mother or like for a nourishment,
Mhm.
and potassium needs a family, and calcarea a home. It's feeling so rhythmic. So I just put, and yeah. So this is that sodium, a person, magnesium, a mother, and potassium needs a family, and calcarea a home actually. So I was actually wondering what could be the difference between a family and a home.
Mhm.
So when I referred, what I got the reply was Calcaria wants that security also, not just a relationship, but complete security. So they want the family, Calcaria, but they also family plus security. That's what a home gives a secure feeling. So that is what they want, that the term the home, the family plus security. But in case of potassium, they are not like that secured feeling, or not for them the family is enough. Not that they don't need a house, but this security feeling is not that much needed in case of potassium. So if it is just family, that's potassium, family plus security, and that's why the term home came up. And calcarea is very much needed of that family plus security. So in case of potassium, if anything disturbs this harmony or integrity of family, it becomes a huge concern, and they can be extremely fearful, anxious, and to escape out, they can become quite aggressive. Like they can go to the level of killing someone also. Then, in case of their constitution, Cali groups in general, they say that they can be strong, stout, and robust. That is very strong constitution, very fit constitution. Or it can be obese or edematous people, or bulky, fatty, flabby, without any fitness. Then another can be a premature old look, black rings around the eyes. People will be having this anemia because
Okay.
this is a good remedy. Not as much like lacusis for a hemorrhagic tendency, but people who have loss of vital fluids and then got into an anemic condition, Calicarb is much indicated, because we saw that this medicine is indicated for the people who are in convalescent stage from deep acting diseases like typhoid. So a
Mhm.
loss of vital fluids, and after to that anemia developed. Calicarb is a good remedy for them. So they will be having some premature old look, or the anemic look, that is the black ring around the eyes. Though three constitutions have been given, the one I gave in pink is most important. So, as like Calcaria, when you imagine a Cali group, you can imagine a person who is very fat, chubby, edematous in nature. That will be the usual constitution of Cali group of people.
Okay.
Then their temperament is very phlegmatic, choleric temperament. Thermal, usually they are chilly, but exceptions like Cali sulf, Cali brom, Cali iodatum. And in all those remedies, you can see the second part, the sulf, the brom, the iodatum. That is what, which is hot, making these drugs also hot in nature. Diathesis, this is more for rheumatic gouty diathesis. Then miasm, all the three we can see, soda, psychosis, syphilitic, and its combination, that is tubercular. That's why it is deep acting and also good for cancerous condition. Direction of action is centripetal. From the periphery, it goes towards the center. Then ailments from, it can be from mind and also some external factors. So from mind, all the feelings like we saw that they want to be in a relationship of family connection should be there. So if something is happening, we saw that they can be anxious, or frightful, and also getting very angry. Then these people, Cali group, they are actually like Calcarea carb also, you can say, in even in mentally. Calcarea carb mentally, we see that they are very slow in comprehension. They're actually good in intellectual matters, but they're very slow. So even in Cali carb, mentally we will see that generally in Cali group, they are actually very weak mentally. There is forgetfulness, absent-mindedness, so mentally they are very weak actually. So any type of mental exertion, overstudy, that is also going to be a causation or etiological factors for them. Then disappointed love, but not that characteristic. Masturbation. Masturbation is an important reason, and there is loss of vital fluids because of masturbation or whatever. There is a, if there is a loss of vital fluids. Thunderstorm is another reason, and overeating. because I told you this medicine has got a lot of action in GIT complaints. So overeating, especially fatty substance, salt, bread, quinine, wine, sugar, milk, etc., whatnot. So overeating is also a problem for them. Do you remember other remedies about thunderstorm is aggravating of an etiological factor?
Phosphorus.
Yeah, anything with R,
Anything what? Sorry,
R,
sorry. Can you repeat?
R. Oh,
Oh, R.
huh.
Okay. Yeah. R. Rhododendron.
Mhm. Rhododendron, then phosphorus, rhododendron. There are more actually. One more is very important.
Mm,
Hmm. Sometimes suddenly I forget these medicines. The earlier only I remembered phosphorus, rhododendron. At least this one. Ah, yeah. Remember?
P.
Hmm.
Mm,
What is the medicine? There's only one medicine.
Sorinum.
It's
They
now
wait.
to
Miss. All of them are aggravated
yes.
during thunderstorms, or like they dread of
They are,
thunderstorms.
thunderstorm, they can be dread of thunderstorm mentally, or
Mm,
either they get physically aggravated. And in case of phosphorus and rhododendron, it's mostly physical aggravation. It's not an etiological factors. It's usually aggravation, or before the thunderstorm, they feel aggravation, or it's like they can sense something is going to happen, or like that. Just
ah,
a few hours or few days, not too many days, 1 or 2 days before that electric storm, the symptoms come out.
mhm,
That's more in case of phosphorus and rhododendron. And phosphorus is also having a mentally fear, maybe because that they're going to get sick, they have a fear. And sorinum, they don't have much complaints. They're generally chilly patients, but they do
mhm,
have a fear of this thunderstorm, more of mental in nature. But physical is actually phosphorus and rhododendron. And that's also more than a etiology, it is aggravating. But here in Calicut, it is etiology. But why I put it together is now when we are doing this differentiation, we remember the finer details that a thunderstorm etiology is Calicut, then aggravation is phosphorus rhododendron, sorinum is for mentally. But sometimes we may not remember this fine differentiation. What we remember might be just thunderstorm and what are the medicines related, whatever it is, whether it is physical or mental aggravation or etiology, thunderstorm related, what are the main medicines. So we just make it is not only this, some other medicines are also the 5 or 6 medicines are there for thunderstorms complaints. That's why I just put it together. But there are finer differences.
okay.
If you get like someone saying this thunderstorm, in case this is just for remembering for the exam or the viva or the MCQ basis, but if you get a patient, it's always better to try to differentiate in the person finally how it is happening. But for exam purpose or the viva purpose, here we don't have the viva, but you don't have to remember this finally, that ultimately you will forget what was what. So use it only for during your case taking, when the person actually says about this complaint thunderstorm, then you can go for the final differentiation.
Okay.
So one of the characteristic feature mentally and physically, all calis are actually hypersensitive or oversensitive. This we can see in their mental and physical. In mentally, they will be easily startling. Just slightest voice, just slightly touching on their body, they're going to startle very easily. And also,
Mhm.
they're very sensitive to touch and all the other external impressions. They're highly sensitive people, mentally and also physically. Anxiety is the about future, almost always, but especially in morning. Fearful, they are extremely fearing persons. We already saw that even as a element or a metal, they are not able to stand by their own. So that we see over here, they are fearful of being alone. They always need someone in their company. The fear of bad news, fear of crowd, etc. Then they're very quarrelsome people, irritable also, especially after coition. And this is important. Though we say irritable during headache, during menses, this is not that characteristic. During headache and during menses, it is very common that the person to be irritable because of the changes that is happening. So this is not that won't be that important, but irritability after coition. That's a characteristic feature. Then, mentally, as I told you, they have that weakness of memory, dullness, absent mindedness, mental labor fatigue. So, that is why it becomes a causative factor also whenever they have to do a mental work, overstudy, etc. Then, they are very impulsive. They have a tendency to do something violent, to even kill somebody. uh, then sleeping tendency because of that constitution, mentally and physically over not over exertion, mental over exertion. They're kind of very sluggish people. We saw that it
Mhm.
is phlegmatic, choleric in nature. Phlegmatic means they are always tired. So these people, they always want to uh, they don't feel that freshness. They are always dull and sleepy all the time. The phlegmatic constitution, that fatty person who is not active, always tired. That is the Cali group actually. They are
Okay.
introverts, very close people, always sad, melancholic, but not as much as that of sodium group. They are melancholic, but not as much as sodium group, and they do not easily share their inner feelings. Then they are duty conscious, extremely hardworking people, especially in managerial, police, judge positions. We can see maybe later stage when they do this much hardworking towards their 45, 50, they feel like, oh no, or they midlife crisis hitting them. Maybe they. Then they dream of dead people, dead bodies. That's their mental features. And in physical symptoms, the weakness and relaxation of muscles, especially leading towards paralysis. That is one of their most important feature, and that is very characteristic. Uh, in case of Cali carb, Cali carb is the most important. I mean, Cali brom is also Cali bi also, but still, when we say Cali group, the first remedy which come into our mind is Calicap. Usually, Calicap is the medicine which is thought first. It is the true representative of Cali group. So maybe that it always comes into mind. So back pain is what which is characteristic of Cali group. I mean Calicap, and the knee joint swelling is the feature of Cali adatum. So one of the most important feature is weakness and relaxation of muscles, especially of the back, and it can go even to the level of a paralysis. There will be paralytic weakness of sacroiliac joint. And this word, that three words that I have kept, that's a
Mhm.
characteristic feature, especially of Calica. If ever one question comes to you, even if it is in mind, now I have done the comparison in later pages. I have not repeated these sentences over the which I have not told earlier, only that I have mentioned. But in case in exam it is being asked, whatever be that, even if there is a Calica mind, these three words are very important in Calicarb, okay?
Okay.
It is bacchic, sweating, and adynamia. So there is the medicine is not complete until we have these three features. So backache is characteristic, which can go even to the level of paralysis. The person is extremely sweaty in nature.
Mhm.
In a way, you should remember it is contradicting the other word we told, that the person will be having a dry excoriated skin. We told that, but
Mhm.
the person will be Cali group. they will be extremely sweaty also. Maybe they are sweating, but still their skin feels dry. I'm not sure, but this person will be extremely sweaty in nature. And then adynamia, or the fever will not be expressed, or the temperature will be subnormal. Then there are chilly patients, I told you, the exceptions being three, the iridatum, sulfur, and also calibromatum. Side affinity, mostly these remedies are right-sided. Rheumatism is a characteristic feature. We saw that their diathesis is rheumatic and gouty. The joints are inflamed, painful, tender, and swollen. But very rarely we will feel that heatness or that hot nature. We don't get. Edema is characteristic because we saw that the person in the constitution also, we saw that the person is extremely edematous. That's a big feature of Cali group of medicines. When we are giving Cali, edema is something that is to be noted. I mean, it will be more indicated if there is some edematous condition. Then edema, it is present everywhere, particularly around ankles and eyelids, and that too in the upper eyelids. Do you remember? I think in the last semester I have told you edema of upper eyelid, lower eyelid, and the whole eyes. Do you remember?
Uh, I can't recall it.
Okay, I'll say you one mnemonic to remember. Have you heard
Okay.
the term CAP, KAP, not the CAP?
No.
Okay,
No.
whenever we do some research study, now you just Google and see when you're free. Just put something you want to study as a research project or something. Always there will be something CAP study, KAP, and that CAP is knowledge, attitude, and perception. So, if something like it will more come when we are doing the public health. So you want to do, suppose you are doing a PhD or even a master, not PhD. It should be done in a lower level, so master's level. So you want to know what is the people knowledge about. I mean, anything. You can take anything. For example, AIDS. So you can
Mhm.
ask questions to know how much people know about AIDS. So that is knowledge. What is their attitude towards AIDS and AIDS patient or AIDS disease? And then what are their perceptions? What they think about? So this is always for everything, like condoms. And then,
Mhm.
if they have the people, the office culture, I mean, anything you want to know, you just do the CAP study. So it will come a lot of CAP study. So CAP is a word that we have to remember when we are doing this research thing. So it is exactly that mnemonic. So it is
Mhm.
KAP. So now you just keep, I think, I hope you can see me. So
Yeah.
KAP. So
Okay.
Cali carb will be, or the Cali group, or better Cali carb, it will be in the upper eyelid, Epis
Okay.
in the lower eyelid, and P, the whole, it will be phosphorus.
Okay.
So you can remember like that. That's how I used to remember the cap word and then KAP. So
Okay.
in case of Cali group, it is the upper eyelid where we have this edema. And there can be drooping of eyelids. You remember any medicines for drooping of eyelids?
Um, was it Taraxinum? That's all I remember.
Which one?
Taraxinum. I think I learned that a few
Tarasacum?
days ago.
Tarasacum?
Yeah. Ah,
Taras
yeah.
Tarasacum is given for thyroid. Is that characteristic?
I think so.
Maybe the for gastric it is MAP deputy analysis. Not in key, not might be third in case of what is that book? Body. Any other remedy you know?
Mm, Impossible?
Yeah. Will be
Gelsemium?
most importantly. So the second letter because we told the second there is a weakness but drooping of eyelids. Because of the weakness, there is a possibility.
Okay.
No, it doesn't say over here those. I don't know whether it is told in some other text, not in this one also. Okay. So anyway, these are the remedies most important. Doping of eyelids, constitumentals, and also Cali group.
Okay.
Then the pain of Cali group is very important. We have so many type of pain. Stitching, tearing, cutting. Out of that, remember the term stitching type of pain. And then the one that I have given in italics, that's very important. Erratic pains, rapidly shifting from one part to another. Pain will be in small parts that even can be covered by tip of the fingers. Patient will be like pointing out like this. This is where the pain. So it will be in small,
Okay.
small spots, and that will be shifting or erratic in nature, like that of pulsatilla. Pulsatilla is having this shifting nature. Lac caninum is having shifting nature. Along with that, Calibichromicum also. But pulsatilla and lac caninum, they don't have this pain in small spots that can be covered by finger. They don't have. They have just this shifting type of pain. So shifting type of pain, someone asks you, the most important will be Calibichromicum, then pulsatilla and lacanine. Put that
Okay.
into by lacanine.
The tip of the finger covered
Yeah,
by
like
that that
they will they can point out. It will be in that small spot, like not in a big area.
okay.
They won't say that the whole abdomen is paining. They'll just
Just
point
one
out.
spot.
Yeah,
Okay.
this is the pain. And sometimes they'll say like that, the pain is shifted like this. That's what usually say, but only if they say we can give the medicine, nothing like that. It's a characteristic feature because I have given
Okay.
for the people who say, especially data, when they say that they have pain in the knee joint, and what the feature I told you, it is extremely swollen, and the person itself was very chilly in nature, and also this was very fat and flabby with edema
Mhm.
and the joint pain. I had given Caliadate, and it worked also. Then what was that? So over the when I gave that medicine, the patient didn't say the second feature that it is pain in small parts. The patient showed actually the whole knees, but we can get people, especially in case of headache or abdominal pain in Calipi. They usually say that's how the Materia Medica says. But I always say it is not that we are going to consider all the symptoms when we are going to prescribe the medicine. That's where the totality comes. We take the symptom, or we take the case in detail, but
Mhm.
then we consider a handful of symptoms of what we consider when we were talking or while we were talking to the patient. We understood some of the symptoms, how importantly or how much stress the patient gave when he was saying some sentences, some of the complaints, and how casually he replied for some complaints. So it is up to the discretion of the um, doctor, the physician, to give importance to the symptoms that he wants to cover. So that makes a totality. We take those symptoms. So sometimes we don't. We may be getting this feature. The patient is having. We're not. He say that I'm having stitching, cutting pain. He may not say. He may just say it is rapidly shifting from other one part to another. And then they may not also say it is in single spots. They may not say. But you see the patient constitution. The patient is generally that one fatty one and it is a chilly patient towards and a chronic complaint. And you don't get indications for other similar remedies like calcarea carb. The characteristic feature for a calcarea carb, if absent in a case of this one Cali group, then we can think. I mean, by talking, by giving medicines, we will understand what kind of whether he belongs to calcarea or belongs to
Mm-hmm.
Cali, and then we give. So it's not necessary that they have all the symptoms in real practice, and then only we give the medicine. But this is more important for actually when we are writing the exams.
Okay.
So they may say by the tip of the finger, but as I told in theory or practice, we may not get that. Still, it doesn't or it shouldn't stop you from prescribing Cali medicine if you think that Cali carb will be working. And if it doesn't work, in case that's what we learn by experience. All the homeopaths doctor, they give a medicine and then they learn from that. And if it doesn't work, then you can rethink what did you do the mistake. Or sometimes it may be the medicine is also correct, but it was the potency that is different. Anything is possible.
Okay.
And the discharges, this is important. The discharges of Cali group is actually thick yellow, whatever it is. The feature is tough and stringy. This is very important. So the discharges, especially from the nose and all, they will be it will be tough, sticking to that membrane. So when we are going to take it out, it will come like a thread. That is why it is called as it is tough. Remaining sticky to that mucous membrane, and then we are going to, uh, pull it out or take it out. It will be coming because it is tough and adhere to that part. It will be coming like a thread, a stringy in nature, thread-like. And this, have you studied in any other medicine? This tough, stringy nature of discharge. Not
Mm,
sure whether you have learned both the medicines. One is with B and another is with C.
tough, stringy discharge. One is with B and the other is with C. Mm, I can't recall this. Oh, Bovista.
Hello?
Great place to play.
Capacitor is mostly the menses, the blood, the menstrual blood will be coming out strangely. And in case, because crocus is mostly having action on female reproductive system, abortion and all. So hemorrhage from the, if it is
Mm-hmm.
stringy, so that the because it is hemorrhage or coming like that, it will be of course dark in nature. But Bovista
Mm-hmm.
and Calibi, it is usually the respiratory from the nose center. Then calis have power to arrest abnormal secretion, whether they may be mucus, serous discharge, or hemorrhage. Though we don't say it as a hemorrhagic remedy, we don't learn about the hemorrhage nature and all. But so this sentence. Then the other characteristic feature is that it sweats in all parts of the body. They desire sweets, and this is another some comparison with Calcarea carb we can make. Calcarea carb is also liking sweets. They have
Mm-hmm.
sexual weakness with loss of sexual desire. But should remember one of the ailments from is actually masturbation. So after excess sexual activity, the loss of fluids, and then getting weakness or debilitated from that, and complaints, so loss of sexual desire after to that. Then there can be GIT complaints, which is highly sensitive in case of Cali group, and they are prone to gastric ulcers, and they are also anemic in nature. Anemic, no need of repeating because we already told in the constitution that they are having that blue rings
Mm-hmm.
and loss of vital fluid, so you can connect anemia to over there. I'll just let it be in case you forget. Then general modality, the aggravation, the time aggravation. Whenever in a drug you learn time aggravation, that is very important to remember. Okay, so the time aggravation is 1 to 5 a.m., which means early morning or after midnight. So if you just learn 1 to 5 a.m., you can put these two things, early morning and after midnight. Then they are chilly patients, so you can put everything that is cold related. And cohesion, we have seen that they have irritability after two cohesion, before and after menses, and we saw that they are very hypersensitive patients, so touch and exertion. So most of the aggravation, this is something I always felt very difficult to learn by myself. I mean, to by heart by myself. So if we most of the drugs, if we learn their general features, from that general features itself, we can make some of the aggravations and ameliorations, and which we can't make, like here the time, that's only what you have to study, not the other thing else.
Okay.
Then amelioration, everything opposite. So pressure, warm, leaning forward, and eating is an amelioration. Eating, uh, yeah, because they have the sensation that the ulcers, because of that, they have the eating amelioration. And chili patient, so warmth amelioration. Leaning forward amelioration is actually coming in their respiratory complaints. In the asthma, they have a particular position. So these are the comparisons we have to make in mind, respiratory, GIT, female, CNS complaints, and also musculoskeletal. So starting with mind, we have calicarb, calibrom, and caliphosphoricum, whose mind are very important. So I started the mind feature with the constitution of the people. Scalicop is generally indicated for the old people, dropsy or paralysis they may be, with dark hair, lax fiber, and inclined to obesity. They will be hypersensitive. We have seen that they cannot bear to be touched, and they start when touched ever so lightly, especially on the feet. So this feature we can connect actually to gout condition or the tophi condition. Uh, you know the gout, right?
Mhm.
The toe, the
Yeah.
metatarsal. That will be metatarsal or metacarpal. Metacarpal is here, metatarsal. So
Yeah.
that will be affected. So it is not just a simple or normal person may not be having, but this is more related. That symptom is more related to gouty condition. So then we can connect that gout is actually that edematous condition, very painful in nature. But usually we don't find that acute heatness over there. So those persons, and they have great aversion to being alone. They're highly irritable, full of fears and imagination and sensation as if bed was sinking. They feel very bad, especially a week before to menstruation. Calibromatum, they are also adapted to obesity, and this medicine act better in children than in adults. They have got a lot of nervous complaints actually. So these people are nervous, restless, cannot sit still, must move about or keep themselves occupied. They have fits of uncontrollable weeping and profound melancholic delusion. They have loss of memory, forget how to talk, absent minded, has to be told the word before he could speak it, which shows some kind of CNS abnormality like aphasia in those conditions. They will be depressed, low spirited, anxious, feel as if they would lose their mind. Then restlessness and sleeplessness due to worry and grief, loss of property or reputation, and from business embarrassments. Like some business loss is going to happen, and from it had already happened, and then because of that they are getting restless, worried, anxious. At that time, like hyosamus, we can think about Cali group. Then, in case of children, there will be night terrors, or that night, the tendency to see the scary dreams, the grinding teeth in sleep, the scream, moans, cries, horrible dreams cannot be comforted by friends. Ready tests cannot be comforted by family, and there will be somnambulism or walking in the sleep. That's a feature which we can also see in case of silesia. So somnambulism, It's a feature of actually calibrome and also silesia. So more of nervous complaints is the feature of the mind of calibrometer. And in
Mhm.
Caliphos, they have anxiety, lethargy, and nervous, struggling easily, irritable, almost similar to Calica. They have indisposition to meet people, they don't want to, shyness, and disinclined to converse. It is because their crowd they don't want to be, but still they want to be in a family relation. That is
Mhm.
important, but not the strangers or to be in crowd. There is brain fag, loss of memory. Califos, because of the presence of phosphorus, they have some phosphorus content also. And phosphorus is a very good remedy for what is that? The nervous complaints. Even otherwise, also phosphorus. Um, what is that? They also have this feature affecting the nerves. So they have the brain fag, the loss of memory. Even the slightest labor seems a heavy task, great despondency about business. Yet also there is night terrors and somnambulism. Though the symptoms are like this, Caliphos is usually given whenever we see that um, he's mm, depressed or weak or nervous prostration. And how can I explain you nervous? That will be the medical terms to say. Nervous prostration is um, like a patient came to you and he was over studying. I mean,
Okay.
exam was near, he was completely studying, and then he finally got into a brain fag condition.
Okay.
That I want to study. So you are giving him medicine. For brain fag, we have medicines like Etosa, then picric acid, argentum nitricum. So these are all the medicines that which are acting on the nerves. And then you're giving the same, I mean, the potency medicine. And
Mhm.
then as a nerve rejuvenation, because it is the potassium and the phosphorus. So, as because it is a cation, important cation, and for the nerve impulse, the impulse to be carried, the sodium, potassium pump, etc. So, for that nervous prostration to be strengthening that, to strengthen that nervous activity or the impulse being sent, uh, we can give one biochem. I told you, I always support this biochem. Okay, according to the maybe because that's what I learned from my college. So when
Mhm.
I'm giving this patient picric acid as a supplement, I will be giving Califos because this has the rejuvenation power for the nerves. So the
Okay.
patient they will be feeling better during their neural development also. And I think I have told you I had given Califos 6X to my sister when she was pregnant.
Oh no, I
Um,
don't think I this story.
oh, okay. So this actually was my sister. She got pregnant, and she got pregnant after 10 years of her marriage,
Mhm.
and that was an IVF process. So around 5 months, that is when we do the amniocentesis.
Mhm.
5 or 5.5 months. She closed the second. I mean, she entered the second trimester. So MTP legally is not possible in India at that time. In India, it can be done until 20 weeks, but not beyond. So this was actually happening in 5.5 months around. And the report came that in the amniocentesis, the baby may be having Down syndrome. So we were in a confusion whether should keep the baby or not. But my sister was so deciding for a baby that
Mhm.
even if it is a Down syndrome, she was ready to accept the baby.
Yeah.
And they told that it is a possibility. They are not sure whether the baby is having Down syndrome. It kept like in a skeptical manner. Like 4 is the limit. I think whatever chemical they tested. Now I don't remember the term what they test, but that one is 4, and she was having 4.5 something. So we can't. They are also not sure whether it is
Mhm.
there or not. So we have to wait until birth.
Mhm.
So when I got to know that, because the action the folic acid is having on the nervous development, pregnant ladies in the initial months, the neural development is happening. They'd say pregnant ladies to take folic acid because it is helpful in
Yeah.
this neural development. So the same action is actually, yeah, I can say folic acid is equal to califos, or califos is equal to folic acid in case in homeopathy. Yeah, that will be the true analogy, how to compare it. So califos, so I gave my sister one, this what, anti-asthmatic remedy, like sulfur, I think, sulfur one dose I gave her. And then when I got to know this, I don't know whether what was going to happen. And then I felt anyway, I will try because we don't know what is going to happen. So just make a try. And I gave her Califos. Since then, when we got to know, initially I didn't give her, okay. But when we got to know, I know the neural development had already happened by that 5.5 months. But I don't know, I just continued. It was anyway 6x, not the potency I was giving. I thought, okay, let's see. And when the baby was born, you will never understand when the baby was born. Uh,
Mm-hmm.
Throughout her growing stage, we were
Mm-hmm.
continuously watching all her milestones. So we got a bit relieved at around 6 7 months because we started. I mean, when she was born, then also continued giving Califos. Then it was given directly to her from the fifth month until my sister delivered. I gave to sister when she delivered the baby. After that, she used to powder the medicine and then give it with the milk something. Only just one pill, okay, one tab. For my sister, I
Okay.
was giving 3 times, 1 2 3. But when the baby was born, I was giving only one tab per day. But by about 6 months, we started seeing like the first the characteristic or the most important milestone is the development of the teeth. So it happened correctly, and she started making small voices by
Oh.
around 8 or 9 months. And by about 1.5 years, she started speaking almost very well. All the milestones were actually happening a lot before. That's the time when we actually understood, yeah, this is actually the nervous thing had developed properly. But it still continued. I don't know.
Mm-hmm.
My sister was so. I was very relieved when I saw the milestones are happening exactly. But this nerve things or the brain related things or the intellectual things, some of it she is doing it early. Like even we always say when the child is actually speaking very early, their
Mm-hmm.
walking nature, like the standing up, it will be delayed for few months. If one is happening earlier, the other will be delayed for some time. But in this one, it was everything happening. She was speaking, and around 8 or 9 months also, she started sitting or standing. I don't remember exactly, but everything
Okay.
started happening 1 month prior. 1 to 1.5 month prior, everything started happening, and I was like, "Oh, there is a precocious development for the baby." Mostly indicates actually in the natrum feature. So 1.5 months, yeah, she started speaking almost very well. And we had another baby in the family who was elder to her for 1 month. Even she was able at the 1.5 years old, she was just able to say one true words.
Mm-hmm.
And my sister's baby, she was able to speak actually a complete sentence.
Wow.
Yeah, 3 words, 4 words. She was able to speak. And anyway, my sister, she was working, took the
Mm-hmm.
baby over there, so, and she continued giving the medicine because she was so scared mentally, She was the one
Mm-hmm.
who had undergone all the tension. But at the age of 2 or 2.5, not 2.5, 2 1/4, I think, both mother and father is working. So
Mm-hmm.
she used to put the child in the kindergarten, not
Okay.
exactly kindergarten, but some house. A girl used to look after her. This baby, one morning, she was like, "Father and mother, you go. I'm not going to any kindergarten, and
Wow.
I will be sitting in the home. I'll be
Mm-hmm.
watching. Just give the mobile. She'll sit in the home and make no noise. So she'll watch the. So my sister asked, so what will, I mean, what you do if anyone comes? You lock the door from outside. You go. Not or just two, I mean, not 2.6 months, maybe around 2.4 to 2.5. We were not expecting such a reply from that age. About
Yeah.
3 years we do expect. But she told this around that time. And when she told, my sister was continuing California at that time. Then I
Uh-huh.
told Kavi, the Kavi is my sister's name. I told, no, it's time to stop California. Just stop it. So she then started because such a dialogue coming at that age, when as well, this is going to be too precocious, and we stopped the medicine at that time. But
Mhm.
now she is actually 6 years old, and
Mhm.
I don't know whether it was intellect or our medicine worked. I really don't know. Uh,
Okay.
but she is actually very intellectual, even in school
Yeah.
level. Very intellectual in the sense, in the school level also, she's very smart, because we have babies, we have cousins in our family. All the babies are like 1 month apart. I told you, another one is 1 year, another one is 2 year old. But when compared to that, she's very intellectual. Certain sentences she studies very well. She
Mhm.
draws. And now that I'm here in abroad, she take part in all the these things. What is that? The school competitions, whatever. Not the
Wow.
studying quizzes, but anything, drawing, singing, whatever, recitation. She just take parts. And then
Wow.
to her mom, she told like she's studying very well,
Mhm.
because she wants to go abroad, because I'm here. She wants to
Mhm.
go abroad for study and
Mhm.
then meet me in abroad.
Wow.
So she's just
That's
six
so
years old.
cute.
Yeah, even I was so impressed. That's what she is, so precocious. She's just 6 years old. 6 years old, maybe it's just saying. I mean, I'm not comparing, but comparing in the sense, not in a negative manner. But I
Mhm.
had another baby, not baby, 8 year old child who told, when we show the photos to them, that kid told that I want to come to Malaysia to see the place. She was eight
Mhm.
year old. But this one, she told at the 6 year, I want to go there to study there and then meet me. But not like to
Wow.
visit Malaysia to see the places. And even now, her intention is, because I did my education abroad, sister
Yeah.
have told, I don't know, that has influenced her very much. So, but we don't expect a 6 year baby to say. So, I don't know whether
Yeah.
actually can be forced worked or not. We don't have any much this much intellect baby in our family. I don't know. So so Calipos is actually a nerve rejuvenator. That's the effect of Calipos, like folic acid. So it is also can be given for somnambulism. So in case somnambulism, either you can give Calipos as a direct potency, or if you are giving Silesia, Calipos can be given as a this one. That is that, a biochem. Then, so that is the mind feature. Then in the respiratory system, respiratory is very important, especially for calicarb and calibi and also calinitricum. That's also important. Though I have never seen calinitricum being given for clinical condition, but it is also given for respiratory complaints. So starting with calicarb, again the constitution, old people. They have loss of vitality, so the people will be anemic. And Calicarb is usually given for tuberculosis or pneumonia or COPD conditions. So in those conditions where there is a chest pain, the pain will be stitching, darting, or pointed type of pain, and that will be rapidly shifting. And it is worse during rest and also lying on affected side. There may be nosebleed when washing the face in the morning. I don't know have you studied, but ammonium carb is another medicine which is having the same symptom, nosebleed when washing the face in the morning. Then there will be cough, and cough of Calicob, it's very important actually. Dry paroxysmal cough, or it can come in paroxysms. But dry, it won't be as dry as like that of a spongia. This will be quite rattling in type. There will be mucus or the phlegm that is coming out. But this mucus, it will be very thick, tough, and stringy. So when the person is coughing, it actually brings out as like a smoky masses or small masses of phlegm that is flying out from the throat. That is the feature of cough. So cough is either dry or paroxysmal, but mostly it will be with viscid mucus or pus, which must be swallowed. Or they won't have the ability to expectorate. And that is because of the paralytic effect or the paralytic effect they are having. So they won't have the ability to expectorate. They will have a tendency to swallow, or it will be spasmodic with gagging or vomiting of ingestion. Like the cough will be coming in spasms continuously, and because of that spasm, the person will have a tendency to vomit also, even the gastric contents to come out. And this symptom, the spasmodic with gagging or vomiting of ingesta, another cough also has got, that is epicac. Epigastric cough also can end with this nausea or the vomiting of the GIT contents. Or the third one, whenever the semicolon is put, is actually showing the options, the third one possible. Okay. So the other one possible is there will be, we already told that expect, I mean, whatever be the discharge, it will be very thick, tough in nature. So it can be hard, bite, or smoky. Smoky means that thick white thing, like small masses. When the person is coughing out, it will be flying out as such. Totally, what the word we can use? What the word can we use? I'm not getting that word for like uncontrollable. It's
Uh-huh.
like when he coughs, it's just coming out.
I see. Okay.
Like that, just coming out like that. He's not had he doesn't have to do much training to expectorate or something, not racing anything, because otherwise if we have to cough, to I mean, whenever we have some cough, we have to if it is to raise that phlegm from the chest, we have to do some hard work, like cough a lot and then raise it. But here in this
Mhm.
case, the cough, it will be tough mucus which will be just flying out when the person is coughing, like that. And that another medicine is Badiaga. Badiaga is also having similar symptoms.
Yeah.
Then they can be also having asthma. Asthma is very important in Cali cough. So they are relieved when sitting up or bending forward or by rocking movement. That is why when we are saying about the amelioration, we saw that amelioration position is leaning forward or bending forward. So when the patient is having asthma, he will be keeping his hands like this and just leaning forward so that he can take the
Mm.
respiration more easily. And that is worse from 2 to 4 a.m. We saw the aggravation is 2 to 5 a.m. So 2 to 4 a.m. or early morning asthma. Then this is a statement by Hahnemann. Person suffering from ulceration of the lungs can scarcely get well without this antipsychotic. So that's his statement actually. There will be difficult swallowing, um,
Okay.
sticking pain in pharynx as of a fish bone. Food easily gets into the windpipe. Pain in back while swallowing. Very much inclined to take cold. I won't say this is as much important. There can be difficult swallowing, which you can connect it with paralytic features, and food easily getting into the windpipe, and that also we can connect it with the cough ending with vomiting or gagging of the ingesta. But this thing is important. Pain in back when swallowing, because they already have backache. So
Mhm.
even the swallowing process that creates a pain in their back. A simple process as like swallowing. So this one would be important. Out of these two sense, very much inclined to take cold, we can connect it with their chilly nature. So among the curve, remember these feature: loose and viscid mucus, or spasmodic or gagging, and the hard throat coming out from the throat when coughing. This is important, and
Mhm.
this movement is important, bending forward, and also the time 2 to 4 a.m. This statement is more important in MCQ. Otherwise, it doesn't matter even if you forget for the exam. Then, in case of Calibicromicum, this is also good for fat, light-haired person, the same constitution what we told, and they will be having the catarrhal affections, syphilitic or sodic. But their constitution is very important. Okay, these are the constitution who are fat and chubby, and also short-necked children. That's very important. Their constitution disposed to croup or croupy affections. Then they will be having this affections of mucous membrane, wherever the mucous membrane is, eyes, nose, throat, bronchi, wherever. And there is a discharge of tough, stringy mucus. We already learned that, which adheres to the parts and that can be drawn into long strings. So, though this symptom we studied in the general feature of Cali, this is a
Mhm.
most important symptom of Calibicromicum. The pain nature, the erratic pain nature, and then the tough, stringy mucus. We have that nature in Calibi actually. Complaints occurring in hot weather, though the complaints are occurring in hot weather, they are liability to take or they are chilly patients actually. Pain in small spots can be covered with point of finger, rapidly shifting from one part to another. Then their respiratory complaints is actually very important because we have so many symptoms. In the nose, they have perceived pain in the root of the nose. So the complaints of sinusitis. That's where we have this when we are touching on this root of the nose because of the
Mhm.
frontal sinus, the sinusitis. There will be the discharge being filled over there. They will be having that pain, the frontal sinusitis. And from the nose, there can be that tough discharge coming either in the form of plugs, the large masses, or what we call as clinkers. Both means the same thing, a large mass of pus or the sputum or the discharge being coming from the nose. It will be sticky. And if we are going to take it out, it will be tough. And from there also, it will be can be drawn into a thread. That is why thread instead of that word they have used the word ropey, like rope. Then green fluid mucus. Green fluid mucus means if ever a discharge is mentioned as green, it shows the syphilitic nature. So in case of ulcer, the nasal septum ulcer or Zena, when they have this
Mhm.
kind of discharge more often, then this is important. So they have violent pain from occiput to forehead if discharge ceases. So whenever there is discharge, they don't have, but if it is stopped, it will be having pain. And sinusitis is actually like that. Once the discharge has gone, they don't have that pain. If the discharge
Mhm.
is stopping and it is getting accumulated over there, in that sinus filled over there, then only they have that pain. So more often, this can be given for the ozena or the frontal sinusitis, those sinusitis condition. Then ulceration of nasal septum with bloody discharge or large flakes of hard mucus, whatever we told being repeated. And ulceration of the nasal septum, I told you, can even in Hahnemann case, Hahnemann had told that ulceration in the lungs. Actually, so this is the feature wherever there is the syphilitic nature producing ulceration. It's also good for diphtheria, where there is a pseudomembrane deposit which is firm and pearly and prone to extend downwards to larynx or trachea. So, in case of diphtheria, there is a pseudomembranous formation that you know, and this pseudomembranous it can either move upward or downward to the lower
Mhm.
tract, air tract, or to the upper part, the pharyngeal, the nasal region, etc. So, in this case, in case of Calibicromica, it is extending downward, and same is with Lacanina. And the reverse, that is this more important for MCQ actually. The reverse is actually, I'll keep the same color, green color. So Calibi and Lacaninum, it is extending downward, and if it is moving upward towards the ascending, then it is Bromine. Then, even because the throat being affected, there can be edematous bladder-like appearance. Even in diphtheria, we say that the child may have a bull neck appearance because of the lymphadenopathy and all. So if there is this diphtheria or any other tonsillitis similar conditions, there can be the whole neck will be appearing edematous, the uvula like a bladder, because edema is a characteristic feature. Much
Mhm.
swelling but little redness. That is the feature, because I told you the inflammatory signs will be very less, but the swelling is most important. Then the cough we told already, violent rattling, but skip this aggravation when undressing, and that we can relate it to the uh, this nature. What is that? The chilly nature. Um, Deep eating ulcers in fossils often syphilitic. That's also a repetition. Then
Mhm.
croup may be the with expectation of tough mucus or fibroelastic cast. You see how much different words they have used. The
Yeah.
same thing to say fibroelastic cast or clinkers. Then what is another word? Cast. Cast is the word another they used, right? Cast or
Mhm.
clinkers. What is the word that he used in the nose? I think not here. Whichever you remember, just make to be yeah, the plug, the clinkers, everything, something very tough, visit, and when it is try to move, it will come out in thread. That is the main thing.
So
Um,
can I just ask to confirm if when they cough,
mhm,
are those the plugs that comes out?
mhm.
So they are the tough, stringy things that comes out when they cough. Is that correct?
When they cough,
Mm-hmm.
uh, it's either that viscid mucus that comes out in masses,
Mm-hmm.
and the thread-like. Usually, the thread-like is coming from the nose when we are trying to pull it out.
Oh, okay, okay, okay.
Like that, like even if from the throat, if it is coming and from the chest, if it is flying out, as we studied in the cough, it can fly out like smoke masses, that smoke, it is that the tough thing is coming together and just flying off. But if it is stuck, I mean, we can't put and pull it out, right? The thread is coming as when we are pulling it out, because it is stick over there, and then we are trying to pull it, the hole doesn't come, it will be coming
Mhm.
out in strange. That's the meaning. But in curve, the cast will be coming out. And if we go for actually the PM condition, um, bronchoectasis, isn't it? Bronchoectasis, COPD conditions, bronchitis, emphysema, and bronchiectasis. Yeah. In bronchiectasis, they have a characteristic feature for the discharge. Remember, there is a special term that is used in PM, and that is the plugs is almost similar to
Mhm.
what we explained in case of this one, like calic carb. Because bronchiectasis, there is a dilatation, there is a position, uh, it's a postural something. In a particular position, if they sit, they will be raising the phlegm very much. And then if
Uh-huh.
we are allowed to sit it, that discharge, the sputum, we can see some fibrils settling down and then the liquid being accumulated up. That is a feature of bronchiectasis.
Mhm.
And Calicarb is actually Calicarb is actually or Calibi is actually matching with the bronchiectasis PM features.
I see. Okay.
Mm, I'm not getting the exact features. The disease enlargement symptoms. Okay, let I go for the Wikipedia because I remember only Davidson. Uh, Other things when I see you, I'm like, what is this? I go for the most simple Davidson. Because no, no, most simple Wikipedia. Immune system chronic obstructive medications, lung transplantation, signs and symptoms. First, you look at drainage, it's in bronchiectasis itself. Just later, no, you try to read the bronchiectasis,
Okay.
and you will see that the symptoms of the discharge of the sputum or how it comes, it is
Mm-hmm.
matching with the symptomatology of calicarb and calipi, especially calipi. So that's how it comes. And even the sputum of bronchiectasis, it is like that fibroelastic because it is getting dilated somewhere and then it is being released. So it takes up that position, that that fibro, I mean, not fibro, that sputum will take up the position where it is getting stuck and then when it is released. You understand. And there is some postural drainage for bronchiectasis. Later you check and see that it is same.
Okay.
And then we go to the drug. You see the document itself, right? Did I lose?
Yeah. 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 I can see it.
Okay. So they will be having this dyspnea, which is ameliorated by lying down. Then deep acting fog ulcers in forces, which we saw already. Sometimes I combine the symptoms from keynote and also boric. That's where the repetition comes. In
Okay.
aggravation, hot weather, but the patient is chilly. Then kali nitricum. This is indicated in asthma, especially the cardiac asthma. So the conditions of pulmonary edema that is most indicated. Of great value in sudden dropsical swellings of the whole body. When there is pulmonary edema, I have already discussed this congestive cardiac failure and the right heart failure, left heart failure, how it causes edema of the body. So it is
Mm-hmm.
more related to pulmonary edema or cardiac asthma. There can be GIT inflammation with this is general symptoms. There will be GIT inflammation with much debility and also relapse in phthisis or phthisis tuberculosis. So both the conditions, the patient either having GIT complaints repeatedly with debility and also
Mm-hmm.
tuberculosis that is repeatedly, then we can think about kali nitricum. There will be sneezing, swollen feeling, worse right nostril, but the important feature is this is a specific for nasal polyp. There can be hoarseness, dry morning cough with pain in chest and bloody expectoration. More importantly, it will be the asthma with excessive dyspnea, dull stitching pain, and that burning in chest. Dyspnea so great that breath cannot be held long enough to drink, though thirsty. I won't say that. Doesn't matter. Laryngeal diphtheria, acute exacerbation in phthisis, spasmodic group. I won't say you to remember all these symptoms. Remember the term calinitricum, it is indicated in cardiac asthma. So definitely there will be dropsy over there in all the parts. Then this one, the nasal polyp and other things. Because it's asthma, you can put these symptoms by your own. The stitching pain, asthma with that calica feature, that stitching pain. And dyspnea is so great, it is, I mean, whether you can remember or not. There is laryngeal diphtheria.
Mm-hmm.
The sting is so great that the breath cannot be had long enough to drink. The person is actually feeling thirsty and he wants to drink in between, but there is continuous dyspnea that he is not even getting gap to take water. So that is the important, I mean, but I won't remember, I just explained you what that means. But just remember calinitricum as cardiac asthma and the dropsy related, also nasal polyps. But most importantly, it will be calicarb and calibichromicum in respiratory complaints. Calibichromicum because of the nature of the discharge, the tough stringy
Mm-hmm.
mucus coming out, the ulceration, and calicarb for the asthma at that 2 to 4 a.m. and the leaning forward or the rocking moment. Rocking moment is coming forward, going backward, like
Mm-hmm.
a swinging in what we do
Yeah.
in swing. That is, so that is the respiratory complaints, and then we go to the next one, calibromatum in GIT. Actually, the important feature is not any complaint, but nervous cough during pregnancy, which almost threatening abortion.
Oh
We
wow.
have another medicine that is conium for this condition, and another one is calibrom. Because in pregnancy, if they are coughing, sometimes I have not given medicine. Okay, a pregnant lady had come; she was coughing very severely, and not threatening emotion, but we feel like she was actually 7 months pregnant and having cough. So in that severe cough, we say that Cocles, Conium, Calibrom are good remedies, but
Mhm.
I have not given any medicine. Sometimes our medicines are not safe to give during pregnancy.
Pregnancy.
Yeah, because it's a very susceptible condition for the patient. We don't even know. Sometimes they can bring about unnecessary aggravations. I
Ah,
just told the patient to continue only these general measures, taking gargling something, not giving, never trust our remedies during a pregnancy. Unless you're very sure, don't give.
okay.
Uh, then GIT complaints. So GIT is another thing. We saw there is ulceration over there. So in case of Calicup, okay, as before didn't, I mean, I have already told, so that's why I'm not mentioning the constitution. But do remember to put the constitution. Just
Mhm.
concentrating with the GIT complaints, there will be stomach. It will be distended because gas problem is very much there. So they will be feeling as if it would burst. Whatever she eats or drinks appear to be converted to gas, as like we learned in iodine. There is
Mhm.
excessive flatulency. So here we can compare the drug with lycopodium, and even in lycopodium there is some similarity. Lycopodium is also with this fat constitutions.
Mhm.
The upper part of the body is obese and the lower part being emaciated. Oh no, other way around. Lower part is semidropsical, isn't
Mhm.
it?
Yeah,
Lower part is
that's true.
semidropsical, yeah. So they are not completely this one. Then the other feature of lycopodium, it is also given right-sided, and they also have this gas problem. But the differentiating feature will be lycopodium is warm patient, desiring warm, and this is chilly patient. Then intellectually, when we go, we see lycopodium to be more intellectually keen people, but not Calicub. But Calicub is so
Mhm.
mentally weak. Then both have desire for sweets, but the differentiation will be these things, lycopodium. Yeah, mostly the mind features. Lycopodium being very greedy, selfish, too angry, too egoistic, and Calicub is not like that. They're more family-oriented persons. Otherwise, the symptoms are somewhat similar, the GIT complaints. Then they have toothache only when they are eating or throbbing and when touched by anything warm or cold. I should put toothache before. And then there is a difficulty swallowing, which we saw earlier also. Sticky pain in the pharynx, pain in back while swallowing. As I earlier told, this is the most important symptom in this. So
Mhm.
during just connecting the swallowing with the GIT complaint, that's all. Then there will be constipation. The stool will be large, difficult with colicky pain an hour or two before. And then the characteristic feature, which I told you, always should be the when we are saying about it, backache, sweating, and weakness. But when I put over there, I had put, I think, backache, sweating, and a dynamia. That is what I put. Uh,
Mhm.
yeah. It can be that this one also backache, sweatness, sweating or weakness.
Okay.
Okay, I'm not making you confused. If I put like this will be. What did we put over there? Weakness, it will go to the paralysis effect. Why we don't, I didn't say like that is when we do with the backache, generally after a long study, especially for MD, we'll connect that backache to the weakness, paralysis, and it will go like that. So that is why yeah, I over there I put a dynamia as like continue with the
Okay.
dynamia itself. But then don't forget the other things, okay? You should remember. Weakness going towards paralysis. When you do backache or the
Mhm.
any pain, you should go towards, in case of calica, it will go from that word you should go to the paralysis, weakness, etc.
Okay.
Then calibicromicum. The GIT complaints, the most important thing is the GIT and rheumatic complaints alternate. That's a very important symptom for calibicromicum. The first sentence actually we have learned somewhere above that the complaints are mostly from hot weather, and but they actually patients. But the important feature is the rheumatism alternating with gastric symptoms, one appearing in the fall and the other in the spring. Rheumatism and dysentery alternate. And another medicine which we have the rheumatism and gastric symptoms alternating is abrotana.
Okay.
Their rheumatism and also gastric complaints alternate. So in abrotanum, have you studied that medicine?
I don't think so.
In abrotanum, they're saying that have rheumatism alternating with hemorrhoid or rheumatism from controlled diarrhea. So if you don't remember like that, finally, it is also okay. Just rheumatism and gastric complaints alternating with each other. Calibi and another remedy with the abrotanum. So that is the importance of calibicromicum. Yeah, no other symptoms are more important than this alteration or alternation. Then there can be bad effects of beer, loss of appetite, weight in pit of stomach or whatever, flatulence. There is
Mhm.
also complaint of stomach, and there is vomiting of ropey mucus and blood. Ropey mucus, I don't know when the person is trying to come out. Let's say that it is ropey mucus. Sometimes that may be the fibroelastic, that shape being taken and it is coming out. Anyway,
Okay.
very simply, what it means is it is very sticky in nature, and when we are trying
Mhm.
to pull it out, it will come in thread or rope like, or it will take that shape of that tube because it is the respiratory tract and the GIT tract, so that shape will be taken. That is the meaning, simple meaning. In different words in Materia Medica, they will say to confuse us. People will say anything during the uh, proving. So in Califos, they do have some symptoms in their GIT,
Mhm.
especially the nervous organ sensation or diarrhea with putrid odor. Everything is offensive. The breath is offensive, and that is because of the phosphorus content they are having. Tongue is coated brownish like mustard. Then diarrhea with a putrid odor, which is occasioned by fright, that is also coming from phosphorus, with
Mhm.
depression and exhaustion. Dysentery, the stool consists of pure blood, that is also the nature of phosphorus, and abdomen swelling. It can be given for cholera. Stools have the appearance of rice water or prolapse recti. Uh, this one, prolapse recti, uh, for an MCQ, this is important, okay? Otherwise, I
Okay.
have not seen clinically because when they put like this, prolapse recti, or giving some symptoms from here, though, the diarrhea, putrid, this one is putrid, abdomen swell, and then prolapse recti. We are going to think about all the other remedy which are having this prolapse symptoms. Ignatia, podophyllum, whatever, sulfur. We will think about all this, but never califos.
Mhm.
It was Calico is what we finally remember for the exam purposes. Actually, it is a rejuvenator. You're never going to remember that prolapse recti. So it is more important in case of MCQ. Otherwise, the CRT symptoms, it's not that characteristic feature. Whatever be the feature is, it's because of the presence of that phosphate content.
Okay.
And something similar to that. Calibrometer, they have a periodicity nature. So just this is also MCQ related, daily colic in infants about 5 a.m. So as told, they're having that periodic nature. That is why daily it is coming. And then about that 5 a.m. due to 5 a.m. aggravation. So that is a feature of calibrum. In the musculoskeletal system, we have seen the backache over there, the pain nature. So pain is stitching, darting, worse during rest and lying on affected
Miss,
side.
I have a question.
Hmm?
Regarding like time modalities, like so any of their symptoms would be aggravated at that time. Is that
Yeah,
correct?
yes. Any
Uh,
symptoms,
like
general
like
aggravation.
like for example, like in arsenic, it says that the asthma is aggravated after 12. So
Hmm.
is it just asthma or like the whole
Any,
symptoms
any,
related
sym-
to arsenic? Just
any
any
symptom.
symptoms. So not just oh okay. Even though it
Hmm.
specifically says asthma aggravated after 12.
No,
So
in case of arsenicum, then we come to the general aggravation. They say a midday aggravation.
oh okay.
This is in the general aggravation. But this one, when it comes to calibromatum at 5 a.m.,
Mhm.
is actually the colicky pain. Uh, when they mention specifically, but we know this if the colic in case of calibrom is coming 3 a.m., like 3 a.m. colic is saying,
Mhm.
for that reason, you can't say that, okay, it is 2 hours less, so don't go for calibrum. No. But if the symptoms are matching, sometimes it may be not be a cali because we put the category as 2 to 5 a.m. So the patient is coming to you with 3 a.m. aggravation. Go for the symptom, whether it is colic, and then you get the calibrum. Calibrum feature, I told you, because I'm not taking the detailed drug, that is why. It is more often affecting the people with CNS complaints. So if it is a baby with some epileptic conditions, so epilepsy is also periodical in nature, and you get that periodicity over there. And then the mother is saying that every night towards early morning, they may not say exact 3 or 4 a.m., but sometimes they may say, but sometimes the patient mother may say towards the morning the baby will be rising with the crying and all. At that time, we keep on the this one on the what is that on the shoulders and then pat that the baby sleeps. So that is usually an amelioration or it indicates the colicky pain actually when they're keeping on the shoulder and then patting on the back means that gas will be going. This colicky pain in babies usually come because of the gas accumulation. So that periodicity we get, we can think for calibrom. But if you're not getting, but you get the aggravation towards this time, and your child feels to have some or the other respiratory kind of problem, you can try with the Cali group, Calibi or Cali Carb. You can just try because this 2 to 5 a.m. aggravation is general feature of all the Cali remedies and any symptom.
Okay.
Any
All right.
symptom, even in ourselves, lycopodium, when we say 4 to 8 p.m., Heliborus, also 4 to 9 p.m. Uh, it can be any complaint. And that
Okay.
time aggravation is very important. And you don't have to be like when it says like this, specifically 5 a.m. Every day 5 a.m. No, can be 4:30, can be 5:30. But that's the general time most of the people they told towards early morning. That's what they indicate. Otherwise, any range 4 to 8 p.m., 4 to 9 p.m. Uh, lycopodium can be told, even heliporus. That is been.
Okay.
Uh, yeah, it is any complaint. Then musculoskeletal, most of the symptoms we have already discussed. The pain nature is important, the stitching pain, aggravation during rest, and lying on affected side. And when we say this symptom, you remember any drug which is having modalities opposite to this, which means
Mm,
amelioration from rest and lying on affected side.
amelioration from
Amelioration
rest.
from rest, which is the means.
Mm,
Amelioration from rest. This is something. Complete, absolute rest.
wait, I'm trying to remember.
God, girl, don't forget your life again. Complete rest amelioration is Brian.
Briar. Oh yes. Okay, okay.
Sometimes we study too much of materia medica that we forget even the smallest thing. So no,
Yeah.
absolute.
Okay.
That remember that even the difference that is given in Allen's keynote, contraindication. I mean, absolute rest is the characteristic feature,
Okay.
mentally and physically. So, what I wanted, and this is something that you have to remember, you shouldn't forget. This is something we get confused also. This exactly opposite is um, bryonia and also pulsatilla is not regarding the rest, but
Mhm.
pulsatilla is regarding life. In pulsatilla, uh, they actually move about. And so it is not that absolute rest is giving them amelioration. They actually move about pulsatilla. But their comparison is coming on the second feature, lying on the affected side.
Mhm.
Pulsatilla move about and they lying on the affected side uh, is amelioration for them.
Okay.
Bryonia, they wants to be in complete rest, but lying on affected side is amelioration for them.
Mm.
You write it down, then you understand.
Okay.
Pulsatilla, walking about, but lying down, not lying down, lying on affected side. So if it is a right-sided field, they
Mhm.
like that pressure. So they lie
Okay.
on that right side so that the pressure is getting actually amelioration. And in bryonia, they don't move about, but they are loving rest or they want to be in rest, but lying on affected side or pressure is amelioration.
Okay.
You got
So
that?
while they are
And
resting, they are lying on the affected side. Is that right?
once again, for it.
So when they are they are resting, they are lying. They're also lying on the affected side. So
Hmm,
both of that will ameliorate.
hmm,
Okay.
hmm. And this one, when it comes to calica, uh, it is bryonia completely opposite. That is, they are having aggravation on breast and lying on affected side is aggravation.
Okay.
So that connection is two factors are the rest and lying on affected side. Rest amelioration, lying on affected side amelioration, bryonia, both aggravation, that is rest aggravation and lying on affected side aggravation, that is calica. Rest aggravation or moving about is what the patient desire. But if they are lying down, lying on affected side amelioration is pulsatile. So remember that, okay? Because it is very commonly used medicines for rheumatic complaints. And why I'm saying this is we can get the patients. It is not just exam wise. Sometimes I say you this is for MCQ purpose or Viva purpose, just theoretical. We may not see the patient in clinically these conditions, but this feature we can get in clinically. There will be patients because we are going to deal with a lot of rheumatic complaints. So because for rheumatic complaints, even allopathic people, they don't have any medicine. They usually give the anti-inflammatory steroids, analgesics, all those things. And after sometimes the patients will be like, after eating a lot of these medicines, they will come to the alternative therapy. They feel like anyway the medicine has to be taken, so better to take some safe medicine. So we will be having a lot of rheumatological conditions, and we will be having patients with this differentiation. So the patients who say that I can't touch that area, when I touch it, it is very painful, or I can't lie on that particular side. And then we have the patients when I tightly bind it, there is an amelioration. So everything, it is not exactly lying on affected side or lying on opposite side. The thing is, what we how we connect is pressure. When they are lying on that affected side, it is that a pressure is coming for them, and that is ameliorating. So these people, if they have the pain on right side, if lying is amelioration, they may be even preferring a tight bandaging of the right side.
Mm.
So that's how we connect, and we will be getting patients who says these different symptoms. That's why you have to remember even in your theoretical practice. All the three are common remedies, so remember that. And they cannot bear to be touched. The shots that we already saw relating to gout. Then they feel bad week before menstruation. There is backache, um, and you can also connect it with the backache while swallowing. In case of menses, they will be having backache, sweating, weakness anytime after abortion or labor or metarrhagia. When eating, while walking, feels as if she must give up and lie down. So this big backache, I told you, it's a very characteristic feature, backache and sweating, and also adynamia, especially when it is acute condition, but there is no temperature. So BSW of the backache, sweating, weakness. Okay, keep adynamia also. That is the most important feature. And this backache, we can see abortion, labor, or metarrhagia. Labor pain is insufficient. There is violent backache. Wants the back to be pressed. In Calicibachromicum, uh, the musculoskeletal symptom, here also the thing is rheumatism, alternating with gastric symptoms because it is the rheumatism. So don't forget that. And the pain nature, in small spots shifting from one part to another appear and disappear suddenly and can be covered with point of finger. The nature of the pains in bichromicum, don't forget. And neuralgia every day at same hour. Doesn't matter. This is more important in that. Can I take 10 minutes more? Do you have?
Yeah, sure, sure. Yes.
Yeah, we'll finish this one. So now the next one is CNS complaint, and CNS complaints is more important in case of calibrome and califos. So in case of calibrome, the constitution, the persons who are inclined to be obese are better in children, and they have this paralytic sensation, which is very common in case of calibrome. There is a loss of sensibility. The sensations will be lost, especially in single parts like fauces, larynx, urethra, or entire body. There is staggering, uncertain gait, feels as if legs were all over sidewalk. And something similar we can find in drugs like argentum nitricum and also alumina. And all these are having a paralytic sensations and acting in CNS. The person will be nervous, restless, they cannot sit still, they must move about, and there will be fidgety of hands. You remember the fidgety of feet or the legs?
Mm-hmm.
You remember which is the
Like,
fidgety in legs?
are you asking me for remedy?
Hmm.
Um, zinc net?
Yes. And then for hands, it is calibrome. Then phosphorus is whole body. And then there is a feature for medorinum, okay? That's what I'm searching for. Like, so what we say for the cap, the edema, like that is this. Zingamet for the legs, calibrome for the hands, and the whole body, like whole eyes, edema, it was phosphorus, like that, whole body, fidgety, it is phosphorus. And
Mm-hmm.
similarly, medorinum has got a feature, but I don't remember whether it was, I think it was upper arm that I refer. Medorinum is a drug which is intense trembling all over whole body. Yeah? Medorinum starts somewhere and ends somewhere. No, it is in the along with Zingamet, fidgety legs and feet. Mm, yeah, hands and fingers, fidgety hands. This is important. There is incoordination of muscles, nervous weakness, or paralysis. Then we go from the mind symptoms. There is restlessness and sleeplessness to worry, grief, business embarrassments. We already discussed in mind. Put it over here also. The night terrors of children. We discussed in mind actually. They have that morning crying, grinding of the teeth that are showing its epileptic features also. Then the somnambulism. So those features from the mind you put over here in the CNS. That's why I put long dots over there. So put from that mind. But remember, this is a paralytic remedy mainly
Mhm.
of single parts, or it can be all over. Then there will be uncertain gait and feel as if the legs were all over the sidewalk. It shows CNS affection, especially cerebellar ataxia, and then the hands and fingers in constant motion. That will be the feature usually for the people who are having seen CNS complaints. They will be having some jerky movements. So that is the fidgeting hands. Maybe somnambulism and this one. Oh, it is not finishing. So there can be spasm from fright, anger, emotional causes during parturition, teething, whooping cough, Bright's disease. So any major disease is coming for them uh, that may produce these spasms over the body. So every condition you see during parturition, that is the delivery process, whooping cough. Even
Mhm.
otherwise also whooping cough is going to produce spasms, a continuous paroxysmal cough. Bright's disease is glomerular nephritis. During glomerular nephritis, spasms over there. Mhm. Then fright, all the emotional causes, fright, anger can produce spasm. And epilepsy, this is because of the periodical nature in case of calica. It will be congenital syphilitic tubercular, means mostly miasmatic in nature. And epilepsy, yeah, it is not simply jerk, it is a serious condition, the epilepsy being coming. So usually a day or two before menses, again showing periodicity. At new moon, periodicity. And followed by that epilepsy, there will be headache. Then, in case of cholera infantum means the cholera affecting the infants, but in that it is not like arsenicum album, like the excess of loss of fluid, but more like cupramet. After the loss of fluid had happened, the the brain going into a dehydrated condition, like seizures or that comatose condition. That is what here, like cupramet, cholera infantum with reflex irritation of brain before effusion, first stage of hydrocephalus. Before effusion, or the dry cholera sicca, dry cholera,
Mhm.
cholera sicca, how you say, cholera SICCA,
Uh-huh.
sicca, SICCA,
Mm. Okay.
the dry cholera.
Mm.
You know what that condition is?
Oh no.
Actually, cholera, if you remember the pathophysiology of cholera, Vibrio cholerae doesn't cause any damage to the this our intestinal cells. What they
Mhm.
actually do is they produce a toxin, enterotoxin,
Mhm.
exotoxin, that is exotoxin, I think. Anyway, it is a toxin, and this one will be changing the electrolyte balance in the body.
Okay.
So this toxin will act on the physiologically, it's something called as CAMP, cyclic adenylate monophosphate, whatever. The net result is excess of ions, sodium, potassium, will be moved out from the intestinal cell to the lumen. And when this excess ion is moving out, it will draw out the fluid also to maintain the osmolarity. So from the cells, all the fluid will be getting accumulated in the lumen of the intestine. And this is what actually in cholera we have that rice water stew, because it is completely isotonic solution. The water, the ion from the cells is coming out, and to manage that osmolarity, the fluid is coming out. It is not like a diarrhea or dysentery per se. It's not the stool that is coming out, but this intestinal fluid, isotonic solution is coming out. And with that, mucus layer will be coming out also. That is why that rice, watery stool, they say in cholera. But there's a condition which is called as cholera sicca, in which this fluid will be getting accumulated in the intestinal region itself, in the intestinal lumen, outside the cell, but in the
Okay.
intestinal lumen. It may not be coming out via the stool, excreted out. But anyway, this has caused dehydration. The fluid is now in the lumen, not in the cells. So the ionic imbalance had happened in the body. So what we see is the fluid is not coming out, or the person is not having diarrhea, but dehydration. Just we will see all the changes what we say in dehydration. That will be appearing in that person, that Hippocratic face, what we say. So that will be the characteristic feature. So that is why they say before effusion. The effusion may not have happened even in cholera or in hydrocephalus. Hydrocephalus means the fluid or
Mm-hmm.
the edema that is being accumulating in the layers. Which layers? I'm not sure. We have three layers over there. Pathologically now I'm not sure. But before that fluid being accumulated, I mean it is accumulated. It is not moving out from the that edematous condition. And likewise in cholera, the fluid has accumulated. It is not coming out. But because the dehydration had already happened, the signs have happened, they will be manifesting it as some neurological symptoms. In that condition, both this calibrom is acting. Similarly, cupramet is also in similar in action. There also the discharge has in cupramet actually the fluid has gone out. We have seen that, and the dehydration is visible like that. But this one, the diffusion has not happened. The cholera sicca or the accumulation in case of brain, the first stage of hydrocephalus before the fluid is getting accumulated, it may not be visible, but the fluid change has happened, ionic change has happened. So even though it doesn't produce any visible changes, it will be producing neurological symptoms. So for that conditions, we can give calibro. Then daily colic in infants about 5 a.m. The nervous cough during pregnancy. Everything, all these things, because it is related to the nervous conditions. That's why we put all everything under CNS. Then this is another important symptom of calibrom, stammering,
Mm-hmm.
slow, difficult speech. But this one, if a child is epileptic and congenital in nature, like from birth itself or within 1 year they have started, definitely they will be having some neurological manifestation. Aphasia will be the, or they will be having stammering, speech difficulty, something, the CNS related symptoms will be the. Calibrom is more about the CNS symptoms. So that is why I told you a daily colic in Calibrom, even if you don't get at 5 a.m., but the child happened to have most of these symptoms, the neurological manifestations, can go for Calibrom. Then Califos, it is one of the greatest nerve remedies. Everything that I told, the prostration, weak, and tiredness, especially adapted to the young people, marked disturbance of the sympathetic nervous system, yeah, like a nerve rejuvenator. So conditions arising from want of nerve power or neurasthenia, which is nerve weakness, mental physical depression are wonderfully improved by this remedy. Then the causes are usual excitement or overwork can vary. Besides, this corresponds to states of adynamia, decay, and gangrenous conditions. I don't feel this to be safe over here. Very nervous, starts easily and irritable, night terrors and somnambulism. Uh, Remember this thing, nerve power, neurasthenia, prostration. Uh, Loss of memory, labor seems to work, a heavy task, drooping of eyelids, right-sided neuralgia, paralysis of vocal cord, so many symptoms. Nocturnal emissions, sexual power diminished, utter prostration after coitus. Let's reduce this. Paralysis of vocal cord or enuresis, incontinence of urine, paralytic lameness in the back, Remember it in the treatment of suspected malignancy tumors. After removal of cancer, when in healing process, skin is drawn tight over the wound. Just remember this, not for the exam. It is actually, we have to remember this during the MD course only. But usually this sentence, I put it because it was asked as a MCQ. After removal of cancer, when in healing, skin is drawn tight over the wound. That was the MCQ question, and because we are never going to write Califos for that. Califos, as I told, we finally remember that for some GIT symptoms and also for the nerve symptoms. So over this, the nerve remedies, the nerve power, the neurasthenia, and anything that is you can remember from that general nature. The neuralgia, the right-sided conditions we had told, then the vocal cord paralysis, the incontinence, the backache, or paralytic lameness, weakness. You can go like that. And ultimately, female reproductive system, Calicarb is important. Most of the symptoms we have discussed earlier, the backache, sweating, weakness, especially after abortion labor. And labor pain is insufficient with violent backache. She wants back to be pressed. She feels badly week before menstruation and backache before and during menses. All the symptoms we have connected with backache, the musculoskeletal. And then in case of calibichromicum, yeah, this is one important symptom. The prolapse uteri in hot weather. It actually acts as a MCQ also. And sexual desire absent in fleshy people. That's also MCQ based. But the importance is prolapse uteri in hot weather. That is the feature of calibichromicum. And calibrom, we are connecting just its cough symptom. The cough during pregnancy, threatening abortion. So in total, Cali is dull person mentally, physically also very obese person. Edema is the characteristic feature. Weakness will be the which will be aggravating even towards a paralytic stage. Nervous prostration will be the periodicity of complaints which is exhibited as epilepsy. Then what? Then they backache, they sweating. That's Cali group in short. Okay, so we stop over here. Tomorrow when you want the class to be.
Tomorrow? Oh, we have class in the morning, right? Thursday.
Yeah.
Yeah. Mm.
Yeah, okay. Don't shift the exam. Don't shift because tomorrow afternoon I'm having exam duty.
Oh, okay. Yeah. Oh, you have to invigilate or?
Invigilate.
Oh,
My
okay.
own exam. My own exam. So we'll do in the morning itself.
Okay.
Okay then. Did you take a screenshot, Farah?
Yeah. Yes. I'll send it to you after this.
Okay. So see you tomorrow.
All right.
Thank
Thank
you.
you, Miss. See you tomorrow. Bye bye.